and whatnot, I'm afraid I'm going to get down to the cow muck level. I think there's a lot of things that are exciting going forwards, but essentially, the question is, are we still covering all the basics that we necessarily need to cover? So just a little bit about us. We're one of the largest cattle-only, well, farm-only practices in the UK. We're a group of 16 practices with around 55 vets, and we just do farm animal. We don't do cats, dogs, haven't any of that to fall back on. It's just production animal medicine. So we have around 3,000 farm clients in around 8 distinct areas, and we've got about 70,000 dairy cows on our books, 40,000 sucklers, and goodness knows how many sheep, but we estimate around 150,000 or so. And we're really focused on, this is our strapline that our marketing department likes to come up with: science, commitment and results. And really, we are one of the few practices in the country that only deal with farm animal. And we've had to change, I guess, how we deal with our clients on a day-to-day basis. We've devolved medicine sales, so I don't necessarily get into conversations about whether we can do a deal on some drugs or whatnot. If you want the cheapest drugs that we can provide you with, we've got an internet pharmacy that deals with all that. I'm more interested in what service we can provide you as veterinary surgeons. And as part of that, part of my role is, yes, teaching and education. I'm an honorary lecturer with the Royal Vet College. We've got veterinary students coming through the practice every day, 5 students at each time. And sadly, not many of those want to necessarily go into farm animal practice. In fact, very, very few. And so we've had to develop our own education and training programs to bring in new vets into the industry who want to do farm animal and support them through it. As part of that, I oversee our clinical board, and we've been fortunate enough to be able to develop different skills within our practice. For instance, we've got a sheep group, so we have a group of vets within our practice that are just focused on sheep. We've got a beef group, we've got fertility and genetics, and each vet has to be part of one of these groups, so you're really trying to push each other on. But that's really about us. Because we are just farm animal vets, our future depends on you guys. If your future isn't secure, neither is ours. And so many of these things that you guys are dealing with are things that we feel we're dealing with too, hand in hand. We've already had discussions about meeting governmental concerns whenever we're coming to pending food crisis potentially, or not, as the case may be, and meeting environmental targets. We also have consumer concerns, and really this is something that was being brought to the fore earlier on when we said, what do our clients want? And essentially we as vets and you guys as producers are custodians of the food chain. And whether we like it or not, and whether there's evidence or not, and we'll come on to that later, antimicrobial usage is something that is coming to the fore with our consumers. And also, we'll speak about later about how becoming more global, as it were, and the pathogens we deal with becoming more global, how potentially we may be in for more than what we expected. So this follows on from this morning, really. This was the Future of Food and Farming report describing the perfect storm, where by 2030, 50% more food and energy with 30% more available fresh water is required, whilst trying to mitigate the effects of climate change. And what we thought was the good news for us was essentially that was predominantly in the dairy and meat products. But as we've already said, is that within the UK or is it not? But I don't think that you guys as the young future should necessarily limit yourselves to the UK. I may get shot for saying that. But certainly we as a veterinary practice are starting to be able to deal with clients in the Middle East and China. And you know, there's no reason why you guys couldn't see those horizons as something to be part of as well. So really, having listened to this morning, it does feel like there is this balancing act going on. Essentially what we're trying to do is have this food security, but at the same time we want to secure our energy supplies, we want economic development, but we want to make sure that the global climate isn't going to be sacrificed for that. And it seems this morning, it seems quite daunting whenever you hear what the previous speakers have said. Why is it important for us to sustain livestock production in the UK? Well, it's estimated we might spend about 36 quid per person per week on food. Total household expenditure on food and drink, 92 billion. No doubt I'll be corrected if I'm wrong, if you're still here. No. 80% of food purchased through supermarkets and one retailer potentially accounting for a third of the market. The question is, what is the value of animal health and welfare within the food chain, and who has a role in animal health and welfare within the food chain? We've heard about how our colleague here has been working with ASDA and essentially the semen that you're using and how that has a benefit to the supermarket and to yourself as a producer. And I have been called up in the past for saying it, but I believe actually some supermarket contracts do actually promote animal health and welfare. And would animal health and welfare have improved on some of those farms if they didn't have to meet some of the contractual obligations for some of those contracts? But I challenge you, who has the role in animal health and welfare? Is it me as the veterinary surgeon, or is it you as the producer? There's no doubt that for all livestock food production systems, improved efficiency and production helps to maximise profitability and reduce the negative environmental effects of farming. And I strongly believe, and I would as a veterinary surgeon standing here, that animal health has a huge impact on productivity and profitability. For many of you, you may see me standing here in my tweed jacket, the classic James Herriot. And that is definitely how most vets often see themselves going into the industry. They like to see themselves as the James Herriot. The guy that's going to fix everything is farmer's best friend, and all they want to do is look after animals because animal welfare is the only thing that they're interested in. And all they want to do is deal with those animals. Those guys who say that they normally just want to deal with the animals normally get kicked out of my practice. Because the reality is that the trade between you and I is a social act, and it's between you and I. If I want my business to develop and grow your business, I have to be interested in your business. This is from the Veterinary Development Council. They recognise that there may be a problem with producing farm vets. They said that essentially vets need to engage more with the business of farming for food. They need to help clients attain profitable outcomes, meet the demands of the market for high quality, safe food, and provide a link on farm between animal health, welfare, and food quality and safety. Critical to this and how we've built our business going forwards is to be interested in your business. If you see your vet just as this, a guy that comes out, calves the cow, goes home, or the vet that comes out and does the TB test, and that may be the only time you see them once a year, once every 60 days, or once every 4 years, I would say you're missing a trick. I would say that actually that vet is also missing a trick. I firmly believe that this method of farm vetting is going to become a thing of the past, if not already. There is a significant shift that's occurring within veterinary. Traditionally, we've been very disease-focused, individual animal-focused, and only really dealing with the tip of the iceberg. What we're really moving towards, and what those forward-thinking producers we've already heard are moving towards, is a cost-effective, comprehensive health management veterinary service that's production-orientated, not just disease-orientated. We need to provide a service that you can access and access well, and we need to be focused on health as well as production. So here he is. This is one of my colleagues, Alex Walters. He'll be really chuffed that I've got his bright, shiny face up here. But the reality is you can see he's wearing his shirt and tie. He doesn't always wear that. But for a lot of what he does wear his shirt and tie. It's not all at the back of the cow. And Alex has been one of the vets that's really worked on our production improvement plans, which you'll hear about later. But essentially what we're trying to do is shift to disease prevention and promotion of health and productivity. Some of that will just be through herd health planning, which some of you may or may not be included in. There's consultations, nutrition and economics, and more importantly, knowledge transfer. More and more of our work as farm animal vets isn't necessarily doing the job, but training you guys how to do it. There are many things that we do that don't take 5 years to be able to learn to do. And there's lots of things that you guys can do yourselves. And for us, teaching you guys that is becoming more and more part of our job. And essentially also working with the KTN groups and whatnot, and new universities and universities existing, in bringing new research to farm level. It's all very well and good that if it's just published in a journal, but how often does it actually get to farm level where you guys could actually be getting a benefit from it?